Thank you for joining us today for Cynosure University's latest edition, Unleash Your Practice Potential with Potenza RF Microneedling with Dr. Diane Quibell. Before we get started, let me review a few housekeeping items. All attendees will be muted for the duration of the webinar. However, we encourage you to submit your questions throughout the presentation using the Q&A feature located on your dashboard. We receive many great questions, as you can imagine, during these webinars. So if we do not get to your question live on the show, be sure to know a representative from Cynosure will be in touch with you soon. Also, we are recording this event and we'll post it to our website at cynosure.com. Without further ado, please join me in welcoming the incredible Dr. Diane Quibell.
Hey, all you cool cats and kittens out there, reference from Tiger King, those of you who are following the Netflix series. Happy Friday, and thank you for joining me today, where we're going to speak about Potenza, Cynosure's newest FDA-cleared device that's a fractional radio frequency microneedling device. So I want to just welcome everyone out there. Most of us are still in our homes. I'm broadcasting from my home. We're still in quarantine, but we're trying to make the best of our time. And my heart goes out to everyone out there who has been affected by the pandemic or any healthcare workers. So love and prayers to you all. So that's just to start to keep things in perspective. Now let's learn about the future. So I want to talk about the skin revitalization market. This is my favorite thing in my aesthetic practice. Flo and I have had a practice for 20 years, and the one thing that never gets old is skin. Literally, because we have devices that treat skin aging. Most of you know that you lose 1 to 2% of your dermal collagen every year starting at the age of about 30. And you lose more if you have unfavorable genetics, environment, of course, ultraviolet exposure, as well as smoke pollution and dietary indiscretion. So let's talk about this skin market. So this is a slide from Medical Insights published in 2019, and you can see on the far left 2018, and these are the actual numbers of procedures done, and then the dollars that is going to be spent. So if you look at the projection from 18 to 19, we're actually on the climb. Here we are in 2020, and we're still climbing. I think we will have 1 quarter of flattening due to this horrible virus that has allowed us to be on this webinar, but then we're going to continue to climb. I tell you that although I think there's been a lot of changes in the world and in America and in our economy, patients still care about how they look. And my patients are very anxious to get back in and have their skin treatments and their dermal hygiene treatments, because most people do know when you look better, you usually feel better. So there is a fast growing market, and we will recapture this market because it's a priority to patients, particularly my loyal women who've been coming to me for many years, and they're still looking great. So patients are actually asking for microneedling procedures. I've had patients ask me for the last few years, Dr. Quibell, are you doing microneedling? And the original needles that came out were needles actually on a pen without heat. And I explained that that's just a mechanical injury, and that's not really what I'm looking for. And I want to share with you the statistics of what's out there now. It turns out 70% of people are looking for some procedure, specifically non-invasive, to help their skin and skin aging and skin concerns. And there's 1.2 million procedures done annually in microneedling. And I just want to share with you at the end, I'll tell you the average cost for these procedures. So there really is a very big market out there, especially for people who have an aesthetic practice or are looking to build an aesthetic practice. So here's the evolution that I was referring to. These were the original microneedling. And these are sort of little pins on a roller, sort of a semi-torture device. I will tell you that this does create a little superficial mechanical injury, and these needles usually go quite superficial. Up to 0.3 millimeters is what most estheticians use. There are also some medical microneedling devices like the skin pen, where the needles go deeper into the skin and you get pinpoint bleeding down to dermis. But what these two things have in common is they're needles only, and they do not create any heat. So now I'm going to show you the Potenza device you see on the far right of your screen. And you can see this is actually an energy-based device. It's not a laser, it's not a pulse light. We call it an energy device because it's radio frequency. This uses electrical energy and converts them into radio waves with high frequency, and these radio waves actually create heat when they hit tissue. I'll explain a bit about that in just a moment. So I want to first compare what I'm familiar with and what you may be familiar with, which are light-based treatments. These are lasers or intense pulse light devices that we've been using to target different chromophores in the skin, such as melanin, hemoglobin, and water. You know the light hits a target and it creates heat, and that heat is spatially confined. And those are great devices for when we're treating light skin, in the case of using an IPL for brown and red discolorations, or sometimes we target water in the skin. Now, radio frequency devices have been quite popular in the last decade, and in the last number of years, radio frequency energy behind a microneedle has also become popular. And I really like this for several reasons. Number one, you can treat all skin types. You know, with lasers and lights, we have to be mindful of skin of color or people that are tan or have melanin. Well, with radio frequency, it is colorblind. It does not matter what color your skin is. The other thing that's really important, it does not matter what time of year it is. And this is important for me because Flo and I have just purchased literally our Potenza in the last number of weeks. We have not gotten it at the office yet, but just a sidebar, I'll tell you, I've been working with this technology since the fall in Cynosure's clinic under the direction of Dr. Sean Doherty, the principal investigator of the work, and we treated many, many patients. So I've done over hundreds of treatments with this device, and I've really seen people come in and they've noticed their skin is looking fresher and brighter and smoother and tighter. So this is a very exciting technology. The reason I'm happy I'm buying it now, we have an unusual downtime broadcasting to you in April of 2020. And because of the pandemic, we're not in our office treating patients, but patients will be ready to come back in, and it's going to be sunny and summer in New England. So I won't be able to use some of my technology that much due to sun concerns and tan. However, radio frequency is colorblind, and I will be able to use my Potenza all summer long, all year long. So I'm really excited to get back into doing treatments that will be safe and effective for my patients over the summer to make up for lost time. So I think now's a great time to get into RF microneedling. And also, the other thing that I really think distinguishes radio frequency microneedling from traditional lasers and lights is control. You can control the depth of the heat by adjusting the position of the needle. So we can go really deep and past the DEJ and not worry about delivering heat that's going to be causing post-inflammatory hyperpigmentation. We can also go deeper, which we know gives a tighter effect through soft tissue coagulation, and we can get a tightening and a lifting of skin through that soft tissue coagulation. So these are very exciting challenges with laser and light-based devices that we're now able to overcome with RF microneedling with the Potenza. So let me show you a schematic of how it works. You see 4 schematic blocks on your screen, and I'll direct you to the one on the left. If you look at this skin, and it's a sketchy schematic, but look on top, you see this clear applicator with needles coming out, and you can actually only see 5 needles. There's way more than that, and in fact, this device has more choices of needles than any other device on the market. So if you look on the left, you apply the applicator to the surface of the skin. When you activate the pedal, 2 things happen. Number one, the needles project into the skin, and we always want the needles in the dermis. So we really want a device that goes deep. And this device goes up to 4 millimeters, which is actually through the reticular dermis for almost all patients when you're treating on the face. So our general depth is 2 to 3 millimeters, but in some body parts, because we do treat off the face, we might need those needles to go deeper. So you always want to get down to pinpoint bleeding. That tells you you're at your dermis. And then at the same time as the needles are discharging into the skin, you can see in the third slide, we are getting heat around those needles. Now, I don't want to speak to this specific tip. This is a very unique tip you see called the tiger tip. That's why I did that little Tiger King reference at the beginning. And this is a semi-insulated tip. And here what you see, it's operating in bipolar mode where the heat is actually extending between the needles. And you can imagine if you want the heat to be deeper, you just push the needles in deeper and you make that heat deeper. The other thing about this bipolar tiger tip that is so nice is just with one pass, you're heating at 2 different levels because the semi-insulated tip allows for the energy to flow where the breaks in the insulation are. And then, so of course, over time, we're stimulating a wound healing response. We go through the 3 phases of wound healing, which are inflammation for 1 to 3 days. Proliferative phase is 3 days to 3 weeks. And then, of course, from 3 weeks all the way out to 6 months, we then have the maturation phase, which is where we really have the upregulation in dermal collagen and dermal elastin synthesis by stimulating heat shock proteins to the fibroblast. So now let's talk about Potenza specifically. I've explained how microneedling works and then heat or RF-based microneedling. Now let's talk about this device compared to other devices on the market. So first of all, the FDA clearance has come in the last 30 days or so, and it's a general clearance for use in dermatologic and general surgical procedures for electrocoagulation and for hemostasis. That gives us some flexibility in what applications we can use it for. So here is Potenza, and you can see there's 4 modes on this radio frequency device. So this is important because there's no other device on the US market that employs all 4 modes. Most of the other devices out there are in bipolar, which is an excellent mode, and many of them have just 1 frequency, like 2 megahertz. This one actually operates not just in bipolar, it also offers monopolar, which I believe has some advantages. I'll show you in a moment. Also, it has 2 frequency, a 2 megahertz frequency, which is rapidly absorbed into the tissue, and a 1 megahertz frequency, half the frequency, which sometimes we like to employ that, especially if we're going deeper into the tissue. I also explained a little bit about the tiger tip and the semi-insulated needles, and this device actually has 9 different tips. Now, I have 3 or 4 favorites that I've used on this machine, but when I get mine in my office, I think I may even like a few of the other needles. So I think it's wise to try them all. Another significant difference between Potenza and some of the other RF devices on the market, it has 2 handpieces. So there's the standard motor handpiece where the micro needles, the traditional tips go on, and those tips have anywhere between 16 needles and 49 needles. But there's also a second handpiece that is a single handpiece and a single needle that we use for different applications. I like to use the single needle for syringomas, sebaceous hyperplasia, blemish, or nodule. So now let's talk about these 2 different modes. So this is where Potenza really is different than many of the other microneedling devices. On the top, you can see the bipolar mode. So radio frequency is an electrical device where we have energy flowing from the positive electrode to the negative electrode. So when it's configured in this mode, as you can see in the top diagram on your left, the energy flows out the positive and it flows to the negative. And in the case of bipolar, the energy is flowing from needle to needle. Now, the needles can either be insulated, non-insulated, or semi-insulated. And in the case here, you can see the semi-insulated tiger tip needle flowing from positive to negative. And this confines the heat superficially between the needles. Now, of course, we can make that heat go deeper if we push the needles in more. So this is really a nice application if we want to treat the papillary dermis with photo damage and aging. Now, if I wanted to treat the reticular dermis, I could push the needles down more and operate in bipolar mode, and I get a lot of heat around those needles. but I want to direct your attention to the lower slide on the bottom left. This is where the device differs from many other RF devices on the market. This is monopolar, and you can see the positive electrode becomes the needle, and the negative electrode is actually a grounding pad that is placed on the patient. So the energy is going to be intense at the tip of the needle, and it will flow deeply towards that grounding pad, giving you a nice diffuse heating. And so this is incredibly safe. You don't have to worry about deep char and coagulation and getting scar tissue and skin contractures. You get a nice, even, deep heating, but remember, you're sparing the surface of the skin, and that leads to less post-inflammatory hyperpigmentation. And that's because you're not getting heat or coagulation up near the dermal epidermal junction. A typical facial treatment that I like to do is I actually like to go deep with the bipolar, and then I also go more superficial with the monopolar. And that allows me to get less char and coag at the dermal epidermal junction, less inflammation and redness at the melanocyte level, and ultimately, we actually have less post-inflammatory hyperpigmentation. Another reason to remind you, this is a great treatment all year long on all skin types. And we can treat not just on the face, but we treat the extrafacial skin. I can tell you I cannot wait to have a treatment of my submental area and the skin laxity. That is one of my biggest concerns, especially on a webcam. So now I want to show you some histology. And the human histology is still yet to come to the presentations, and it's in preliminary production, but that has, of course, been done. This is porcine histology that was done, and this is using an I-49 tip. That means an insulated tip with 49 pins. The total energy is delivered throughout those pins, and you can see on the top left, the traditional stain we're used to looking at is hematoxylin and eosin, and you can see here the area that the needle has entered, and then over time, 30 days, we're just starting to see the beginning of collagen production. But even at day 28, you can see in the second slide on your left, collagen type 1, and on the very bottom, collagen type 2, which is at the dermal epidermal junction. And then on the far right, you see two other stains that stain for various dermal proteins, such as elastin. This is the Mason trichome stain and Victoria blue. Remember, 28 days is not the end of your results. It takes a full 6 months to build new collagen from each of these treatments. But because they're fractional treatments where we're only applying heat at the level of the needle, of course, we need a series of treatments, generally 3 to 5 treatments at about a month apart. Now, I put this slide up here so you could just remember from your high school physics the difference between frequency. You know, lasers are measured in wavelength, and you also know that light is a wave. So if this was a wave of light that you're seeing represented on the right, the wavelength is measured between the two peaks in light or the amplitude. And so that's what defines the wavelength. The top would be a short wavelength, and the bottom is a longer wavelength. Well, when we're talking about using sound as a wave or radio waves, and by the way, 1 and 2 megahertz is approximately in the AM frequency. It's FM frequency is a little bit higher. This is considered a medium frequency. You can see the frequency of the waves is higher in the top one on the right, and lower frequency is the bottom one. And high frequency is more quickly absorbed into the tissue than lower frequency. The other thing that changes the rate of absorption is the hydration of the tissue. So when we have patients come for any RF treatment, we always remind them, drink plenty of water, stay well hydrated, and don't go out drinking the night before or have too much caffeine, because that changes the water content in your skin, and it can affect the impedance or how the tissue heats up with the needles. So I have a slide here that represents, it looks like my office. I have all of these devices in the office, and you can see on the far left, Temperature Envy. That is a Cynosure technology that is a 4 megahertz radio frequency, but with no needles. It's a flat beam. And this can be used on the face, Temperature Envy. There's Temperature Firm for the body, and there's really no downtime at all. People get up off the table, go right back to work, and they just look a little glowy, but there's really no social downtime. The next slide to the right represents the PicoSure laser. And I love the PicoSure for a treatment we call Pico Skin. And we use the focus lens that creates an injury called an LIOB. And this happens above the dermal epidermal junction, but this creates a pressure wave that stimulates new collagen and elastin in the dermis over the course of the maturation phase. But the downtime for that socially is very low. People are pink for just an hour to two, and the next day they're not swollen at all. The third slide that you see in the square is the device we're speaking about, Cynosure's newest device, the Potenza. And the Potenza, you can see, is actually very low downtime. And I have to tell you, this surprised me when I was treating patients initially. Because you're using needles and you're getting little pinpoint bleeding, you can think the patient is really going to look bad the next day. Right after the treatment, they look akin to raw meat. But I will tell you, because the needles only release heat at certain zones that you can control, the downtime is very minimal. Patients are barely swollen the next day. Sometimes they have a little bit of crusting on the surface, but we let them go out and we let them wear makeup the next day. So this surprised me. There is very little downtime to the Potenza, which makes it very pleasing for patients. They don't mind coming back every month for treatment. The fourth device over is one of my favorites. It's the Icon, which is a platform device. It has IPLs that target brown and red discolorations. And if you're targeting vascular structures, you're going to be puffy for about 3 days. If you're using the 1540 laser that targets water in the skin, you also will have these microepidermal necrotic debris in your skin, and that creates a lot of edema. So the downtime for the Icon, which is considered a low downtime, it's even better for the Potenza. And that actually surprised me. Maybe that'll surprise you. As we march across, we now see the Smart Skin, a fractional CO2. It's an ablative laser, so of course there's barrier repair, and there will be significant downtime with that. And then you can use the temperature platform using surgical applications, and then of course you have a surgical wound that requires healing. So this is very acceptable to patients. In my experience in the clinic, patients were very happy to come back at a monthly interval, especially after 2 or even 3 treatments, when they were noticing their skin was looking better, not just to themselves, but their friends and family were noticing the improvement. And I'll show you that in the before and after slides in a moment. So to review the Potenza difference, it's the world's first 4-mode RF system, 1 and 2 megahertz, mono and bipolar, and I employ those in most of the treatments. The Tiger Tip technology allows for 1 high density pass because you're treating at 2 different levels with this semi-insulated tip. It makes for a nice, fast, and easy treatment. That's a tip that I really like to use on the jawline and the neck. And then on the far right, you have the single electrode that gets fitted on a different handpiece, and that can actually just zap a little lesion like a syringoma. So here's your device on the left. And with the starter kit, you get, as I mentioned, the 2 hand pieces, and that's unique and different. You get this thing on the bottom, which is a cart. Actually, the machine is just the top part. The bottom is a nice, easy to pull around cart. And then you get a starter set of tips. I actually really like the I-25 tip for the face, and I really like the Tiger tip. The 49 pin tip, I really like that best for treating areas of loose skin like on the abdomen. We've had some nice results with that. And then the single needle electrode. And of course you need the return pad if you're going to use the device in monopolar mode. So now let me show you some of the before and after photographs. And these are some early results. I will tell you, it gets better and better over time. As you know, it takes 3 to 6 months to build new collagen. So I'm looking forward to getting this treatment for obvious reasons. Look at this beautiful result. This is just 1 treatment, and that's somewhat unusual. It usually takes 3 treatments to get this beautiful tightening through soft tissue coagulation and improvement in looseness of skin. But you can also see the surface textural irregularities nicely improved. And we like to treat at the angle of the jaw, and we go all the way down. Because you're controlling with a needle, you don't have to worry as much as a flat beam radio frequency, as in with the temperature, about going over certain structures. So we're never delivering heat down deep towards the thyroid gland. So very safe and very effective. One side effect you can get is little bruising under the skin, of course, if you hit a vessel. And now here we have a patient with a combination of large, dense pores, active acne, and the beginning of acne scarring. And these patients are really very frustrated and, in fact, very appreciative that we have this improvement. Now here's an abdominal photo. You can see an improvement in the texture, in the laxity, and this gal actually didn't even lose weight. She did have an improvement as well in the adiposity. So what we have noticed is if you put the needles really deep, between 3 and 4 millimeters, you can coagulate some of the dermal fat. Here's a very typical result, and you can see just 2 treatments, and we've treated her face and neck, and you're starting to see some improvement in the mandibular contour and in the submental, some tightening. She'll obviously need more treatments for an optimal result, and you can see here her skin texture on the face is definitely smoother. And then here's a slide from Dr. Yoon in Korea, and you see a really nice result here, again, on the acne change. And this patient actually has early acne scarring, very superficial rolling scars, and post-inflammatory erythema. And so many of those patients go on with the persistent erythema to get post-inflammatory hyperpigmentation. But if you can resolve the inflammatory process and improve the wound healing, you can actually mitigate that response. And another patient from Dr. Yoon. Excellent results. And here's a lovely patient who I was able to treat in the clinic. And you can see in the submental area and along her jaw, a nice improvement in her contour as well as in her facial skin. So that's it for right now. I do want to tell you that we actually combine these with other treatments. It's very common. We know these little channels with RF microneedling stay open for about 6 hours, and we like to get that solution in there within 5 minutes of the needle injury. So there's lots of combinations, lots of things that you can do to customize for your patient's needs and for the needs of your practice. And just so you know, the average cost for microneedling is somewhere between $900 and $1,200. We'll include it with PRP for $1,200 per treatment because that's what my patients are looking for. And a treatment takes me just about a face treatment, about 30 minutes to do face and neck. I book a 45-minute treatment time. So before I get to question and answers, I hope you're enjoying the Cynosure series, that the marketing people, shout out to the Cynosure marketing people. They're working well over 14 hours a day to try to bring you all of these great webinars. They're doing 2 every week. It's amazing. This past week, they had Dr. Marisa Dado, who's a friend and colleague of mine from Geneva, Switzerland, talking about Max G and Yellow and the ICOM platform for photorejuvenation. We had Potenza today, and next Tuesday we have a marketing talk, leave no stone unturned, and how to acquire leads and convert them into consults in your practice with my friends Josh Smith and Megan Monfrey, and they're excellent and entertaining to listen to. So think about having yourself and even your staff, if they're home, have them log in so they can learn about this. Helps engage your staff. And then the next scientific presentation or clinical presentation will be next Thursday, April 9th at 11 a.m. with Deanne Robinson, who's a prominent dermatologist in Connecticut, and she'll be speaking about increasing ROI while decreasing body fat, something we're all going to need after this quarantine. So thank you everyone for tuning in and listening. Hopefully now we'll have some time for questions. And for me, sometimes I learn more from the questions than I do from the presentation. So Barb, has anyone chimed in and have any questions?
Yeah, Dr. Quibell, hi, thank you. Great presentation. We have a variety of questions coming in today. Some, obviously some very clinical questions, and then some business related questions about your decision-making processes. So let's start with this one. Compared to other devices you have in your practice, where does the Potenza fit into the ladder of aesthetics that you want to provide treatments to your customers? Where does it fit in? And also, what do you see as the advantage for Potenza?
So that's a great question, Barb. And before we buy a device, we always say to ourselves, do we need another device? Because we have a lot of them. Now, some of the reason we buy devices is we have a loyal following of patients, and they really have an expectation that we get something new every year. And it's been about a year since we've had some new technology come in. And so patients have actually been even asking me, Dr. Quibell, when are you going to get radiofrequency microneedling? And I knew this device was on the horizon. It's not the first one to market, but it has these 4 modes. And what I've learned by working with this in the clinic, I've learned that it's really important for some patients to be able to have monopolar as well as bipolar. So I'm glad I waited and I didn't get any of the other RF microneedling devices, because this allows for a lot of versatility, and I can really customize the treatments toward what the patients are needing. So I'm glad we bought it. The biggest advantage of this, I think, Barb, is it really gives me control. With all my other devices, I have to deal with heat at the surface, or I really can't treat in tan skin, or if someone is slow to get their melanin degradation after having a suntan, I have to wait. So this is a patient who I can actually go and I can treat. Of course, we're going to encourage sun avoidance after the treatment, but because we can derive the needles in deep and control the amount of heat at the surface, we can treat patients all year long on and off the face. So I think this is actually going to be very busy for us in the summer season, where I can't do a lot of the other technologies. So that was one of the reasons we bought it. The second reason is I'm really looking for something that can help a bit more with lifting, tightening, and improvement in laxity. And this does so through applying heat and soft tissue coagulation. If I want the heat deeper, I can just drive the needles in deeper. I also didn't mention that there's some intelligence in this machine called impedance monitoring and impedance mapping. And the machine actually can read how well the energy has flowed to the tissue, and it will actually give you a reading. You want your impedances on your screen to be under 500, preferably in the 2 to 300 range, and you'll be able to see that readout. If not, you can actually change your technique, or you can add a hydrating compound onto the patient's face, so you know they don't just get needles, they get accurate delivery of heat, whether you're in monopolar or bipolar mode, whether you're using 1 or 2 megahertz frequencies.
Okay, that's great information for us today. It really answers, you were able to answer several questions that I had here in advance, just in that one little section.
I
Thank
know,
you.
I'm sorry, I get excited about all the
No,
frills and
no,
whistles on this.
it's excellent. So I have some clinically related questions here coming in. Can you treat over the thyroid?
Treating over the thyroid, I think you can, but I actually like to use a different technique. It's hard for me to show you, but maybe you can see on the webcam, rather than me just applying the flat tip, and we'll just picture this as my skin over my thyroid, you can actually pick up the skin and apply the device to the elevated skin. So by lifting up the tissue and applying, you can actually treat very safely over the thyroid. And I would encourage, when you're over the thyroid, use bipolar mode, not monopolar mode.
Okay, thank you. So during your time with your clinical trainer, when you were being trained by Cynosure on this device, were those some of the techniques you learned? And what other techniques did you pick up during your clinical training initially?
So this is a new device for me, so I haven't been trained from my Cynosure trainer on this device yet, because it's new. On the other hand, I've had a lot of Cynosure training on other devices, and I will tell you, the trainers really have a great experience on what other physicians are doing, and we all learn from each other. So I find, just because the trainers have so much experience working with all other nurses and physicians, mid-levels and estheticians all over the country, we share that information with each other so the patients can benefit from the outcome. So I actually think, if your question is the Cynosure training great? It is, and I'll take a little credit. In the clinic, when we started working with this machine, it wasn't as smooth as it is now. Now we have the pain under control. We know how to deliver the energy, how not to compromise results, get optimal outcomes, but make the treatment safe, effective, and comfortable for the patient.
Perfect. Sounds like you're learning things along the way too, which is really great. Thank you for letting us in on that. Speaking of patient comfort, how are you, we have a question asking, how do you mitigate the patient's discomfort? What are your methods?
Okay, that's important. So number one for this treatment, you need a very good high potency prescription topical. And there are several topicals out there that you can have compounded. If you have a compounder that you like, you can use your compound, but I would encourage you to try adding DMSO, dimethyl sulfoxide, which is a penetration enhancer. And instead of a topical going down maybe 500 microns or a millimeter, you can get it down deeper. If you want to get it down deeper, you can also occlude with saran wrap or plastic wrap, but the DMSO in the formulation can be helpful if you have a formulation you like. Now, I do have a personal formulation that I like, and I want to share the recipe with you. It's a 20% lidocaine prilocaine in an ointment. And I have found that there's a particular compounder that makes this ointment in their proprietary base. There's many different compounders, and I think you should reach out to Cynosure if you want to find out some of the better ones, but I like 20% lidocaine and prilocaine. And let me tell you why I like the prilocaine. Unlike when we're targeting vascular structures where we want vasodilation, we in this case want vasoconstriction, right? We're putting needles into the dermis and we don't want to have any additional bleeding. So prilocaine gives you this blanch out effect similar to epinephrine, and it really helps with the amount of bleeding and the discomfort during the treatment. So my patients have found that this treatment is very tolerable. There's areas that are more sensitive, like under the eyes and the upper lip, but the rest of the face, very comfortable.
Okay.
Also, I should say one other thing. We do have some patients that use Nitronox. That's a 50% nitrous oxide with 50% oxygen administered with a nebulizer tube or a face mask. And it just makes patients feel light. They self-administer, so it is not anesthesia. It is considered analgesia, and it really just takes the edge off. I say it's like having a glass of wine or two before the treatment, but that is frowned upon by the Board of Medicine. So this way, the treatment is more tolerable for the patient. And then sometimes we have a device called a Zimmer chiller, a forced cold air chiller, and the patients hold that tube, or my staff holds that tube, and we blow the cold air on the patient's face, and that is nicely distracting and makes the treatment more comfortable.
Okay, great. I have a question here from one of our attendees. She's asking, do you need to change the tip if you want to do one pass using monopolar and another pass using bipolar?
So that's a really good question. The answer is no. So you can keep the same tip if you're switching between monopolar and bipolar. And that's usually what we do. So for a typical face protocol, we like to do the deeper pass first with bipolar, and then the more superficial pass, we bring the needles up for the second pass and we bring it into monopolar. And I like that better because I think we see much less post-inflammatory hyperpigmentation with the monopolar mode when the needles are more superficial. Also, the impedance conduction is much better in monopolar mode than it is in bipolar mode than when you pull the needles up to the surface. So you can see the advantages of having these four modes.
Okay, great. And at what point would you use a micro-insulated needle?
So there's different types of needles. There's insulated needles where the heat just flows out the tip of the needle. And that's when I want my tip, my heat just to be deep. And I like to use the insulated needle in monopolar to go deep. Otherwise, I'll actually pull the needles up and go bipolar where the heat goes needle to needle. So monopolar, remember, is delivery from the needle tip going to the grounding pad. So you get this really diffuse depth of heat. And you can also use monopolar when you're getting up near the DEJ to minimize the risk of PIH, but the same needles for both. And I should mention that each of these tips have 1,000 pulses on them. To do a typical face, I generally do between 900 and 1,000 pulses. To do a typical neck, I do somewhere between 300 and 500 pulses.
Okay, very good. Thank you. We're going to switch gears for a second to some marketing questions. Tell us a little bit about your post-sale support for Potenza in terms of marketing.
So Cynosure provides us with a bunch of marketing brochures and information. Patients often will come in, they read something on my website or they saw a social post, and then they'll sort of look at you and say, oh, yeah, I was kind of wanting this procedure. You seem nice on your website, and they'll come in and talk about it. So regarding the post-sale support, I like to provide the brochures to patients, and Cynosure does a nice job helping with print brochures, and they'll easily come in and also educate my staff on how to answer the phone and how to market these procedures and how to answer any questions if someone is not ready to book a consult and they're just looking for general information. So that's another thing about Cynosure. I always say they don't just make great devices, they also provide you with the marketing support you need so that you and your staff can close consults and really ramp up your business.
Okay, thank you. Just for our attendees out there, in the little handouts box there on your screen, you have a brochure for Potenza. You're welcome to download that and read a little bit more on the Potenza. So I have a question here. It's back to the clinical questions. I'm just pulling it up. I'm so sorry. The question is coming in from a gentleman. He's asking, what any role for Potenza combined with Tempsure, or is it an either or situation? Could Tempsure be used for the needle phobic people?
So I actually think that's a really great question. So we do lots of combinations to get optimal outcomes at the office. And if I were going to combine this with Tempsure, I haven't done it yet, just so you know, but I would consider if somebody had a little bit more laxity, you could use the Tempsure as it's a 4 megahertz deep heating device. And you would do that first, and then I would use the needles secondarily. And you would want to do it in that order. So you don't want to do the needles and have, pinpoint bleeding on your field and then adding heat with the Tempsure. But remember, the Tempsure is a sublethal heat, and that heats the skin to maybe 40, 42 degrees at the most. And that's going to cause one type of wound healing. This is a mechanical injury with a needle that you're controlling the depth, and then you're actually getting coagulation, which is about 60 to 80 degrees at the tip when you're in the depth of tissue. So 2 different applications, 2 different delivery systems, and 2 different types of energy-based radio frequency tissue interaction. So they should be very synergistic. Where I wouldn't use this with a fractional laser. I think it reproduces some of that similarity, and then you could actually have an untoward effect with bulk heating.
Okay, awesome. That's really answers that question. Thank you so much. So we've covered so much ground today. I have a couple more questions. Going back to some of your slides you had on what is a typical client for Potenza. We know that it's any skin type. Can you just describe to us in your practice, what is your protocol? What will your protocol be for a treatment? Like how will you begin your treatment, and then how long will it take to complete your treatments?
Sure. So those are good questions. So once I decide that the patient is a proper candidate for treatment, and I will tell you that I think this is a really spans the spectrum. I will treat patients probably in their 20s and 30s if they had acne scars, but my typical patient would really be more the aging patient if I was not treating scars. So if I'm looking for improvement in skin tightening or in treating skin laxity through using this soft tissue coagulation mode, we would actually treat people probably some in the ages of 40 to 70. And for Tempsure, my ages is usually 30 to 50. And that's generally how I categorize it. The patient would come in 30 minutes before they were ready to be seen by me. Their face is cleansed. We take really good before and after pictures, have the consent form signed, and we apply the topical numbing. And we really want this numbing to be on for 30 minutes. So maybe actually we should have them come in 45 minutes before if they haven't yet signed the consent form and done photos. You really let them sit with this topical on. If you want to get more intense delivery, you can actually occlude it. And then the patient is wiped up and they're brought into my treatment room by my staff. So my staff will have everything ready to go. And again, there's no eye shields because this is radio waves. There's no concern about injuring because we're not using light to the front of the eye or the back of the eye. So we just begin treatment. And I mentioned that it takes about 30 minutes to do the 1,000 pulses on the face. On the neck, I like to do between 300 and maybe 500 pulses on the neck. The neck, I do one very high dense pass. The face, I generally do 2 passes. So I do about 400 or 500 pulses with the first pass, and then I bring the needles up for the second pass, and then I do about 400 to 500 pulses with that. So a face and neck treatment, I would book 45 minutes. For the face treatment, I should be out of there in 30 minutes. And I did mention what our charges are going to be because I think that's important for people to know. We're going to charge $1,200 per treatment, and that will include a PRP on top. If you don't want to do it with PRP, your average price point is going to be anywhere from $850 up to about $1,000.
Okay, great. And so when you have a patient coming in who, say, has had just a traditional pen in the past, microneedling pen by an esthetician or in a smaller practice, how do you position this when you're discussing with them obviously the cost increase of this particular treatment versus the basic pen that we all have heard of?
Well, you know, Barb, they do say you get what you pay for. And I think with the microneedling pen, you're just getting a mechanical injury. There's no heat. There's no inflammatory mediators. You work for Cynosure. You know that heat really is what is the determining factor to build optimal scaffolding in your collagen and your elastin. So I've never been a fan of the needle only. I don't think it really does a lot. I've had patients I've been poking at with needles for years doing mini injectables, and I don't think the needles alone are really worth it. I feel like if you're gonna bother with a treatment, you need needles and heat, or don't just do the needles. With all due respect to those home devices and some of the lower level devices out there, I think they really just are limiting in their efficacy.
Yeah, you're absolutely right. You do get what you pay for. Thank you for that. Well, Dr. Quibell, looks like we're out of time today. Thank you for sharing some valuable clinical education on Potenza and your business practices. And our students today had a glimpse into your best practices and some practical solutions with Potenza. We're very grateful to have you with us. Thank you for that. Join us next week here, folks, for Cynosure University on Tuesday, April 7th for a chat with Josh Smith and Megan Monfrey on aesthetic lead acquisition strategies. Leave no stone unturned. And then also again on Friday the 9th, we have the incredible Dr. Deanne Robinson, who'll be sharing ideas on how to successfully increase ROI potential and decrease the fat. That sounds amazing. Thank you for attending our Cynosure University today. Have a wonderful weekend and don't forget to register. Thank you again, Dr. Quibell, and bye for now. See you all Tuesday, April 7th.
Thank you, everyone, and spread the love and wash your hands.